news now. Some senior patients are stuck in Nebraska hospitals after being discharged. A recent study shows a couple hundred people are dealing with this issue every month. Channel 8's Veronica Barreto joins us now with more. Veronica?
Some patients, especially elderly, are waiting months at our hospitals, waiting for a care place, and it gets worse when family members aren't immediately available to fill paperwork. Around 225 patients struggle every month to find a place of care after a hospital discharge. Most of them are people 60 and older. That's according to a survey conducted by Nebraska-Hospitals-association.
These are patients who have been discharged for at least 7 days. The majority of these patients are elderly, but not all of them.
Data collected from July shows 18 patients have been waiting for over 6 months. 52 have been waiting from 1 to 6 months.
There are a lot of times when patients end up in the hospital because their families can no longer take care of them.
The NHA says finding the resources and filling out the paperwork takes time, and it gets more difficult if a patient's family is not immediately available.
Sometimes families are out of town, sometimes families are struggling themselves. So it can be a struggle for social workers, case managers to get a hold of or utilize family when they need to find placement or find payment for placement.
The Nebraska-Hospitals-Association says another problem is sometimes care facilities do not have appropriate equipment for patients with more chronic illnesses and needs. But this problem affecting our oldest population is not an issue only seen at hospitals, as many family members struggle or cannot take care of elderly people's expenses and health care. Shelters like the People's City Mission are seeing an increase in elderly people looking for a safe place.
24% of all of our men staying at the shelter qualify as elderly over 60, and 10% of our women. And that's a huge increase from historical numbers.
And the NHA says there are resources for families that struggle to take care of elderly regardless of the reason. They say you can contact aging partners, a primary care doctor, attend a medical event.
Veronica Barreto, thank you very much for that story tonight.